Hi everyone, today we are going to see about CPR, cardiopulmonary resuscitation. According to 2020 revision of AHA guidelines, this CPR consists of three steps: CAB. C stands for circulation, airway, and the breathing. On the last video, I have told regarding how to check pulse and respiration. So here we comes with the circulation, airway, and breathing. Regarding circulation, it is mainly about quality chest compression. For a good compression, we need to remember 6 important elements that are the position, second, the compression ventilation ratio, next one, depth of the compression, next one, the chest recoil, and the final is minimize the interruptions. Position means for both the patient and the person who give compressions. The patient should be in a flat surface and keep as much as close to the person who provide compressions. Next one, the position of the hands. The position of the hands is place the non-dominant hand heel on the lower half of the sternal bone. Then place the dominant hand over the non-dominant hand and interlock both hands, and you can give a quality chest compressions. Next we are going to see about compression ventilation ratio. For an adult CPR, the compression ventilation ratio is 30:2. If it is 2 rescuer or 1 rescuer, it will be the same. For a pediatric CPR, the compression ventilation ratio is 13:2 for a single rescuer and 15:2 for a double rescuer. Depth of the compression. In an adult CPR, the depth of the compression should be at least 5 cm or 2.5 inches. For a pediatric or neonatal CPR, the depth of the compression is 1/3 of the chest. Next one, the complete chest recoil. By allowing the chest to completely regain back to its position will help the heart to refill its ventricles, and which will improve the cardiac output as well as the survival of the victim. The final and most important thing we should remember is minimize the interruptions. If there is 2 persons giving the compressions, then one should give compressions continuously for at least 2 minutes. Only give breaks for the rescue breaths in after 13 compressions. If there is an advanced airway, there is no need to stop the compressions in between to give rescue breath. If advanced airway is there, then you can give rescue breath once in every 6 seconds. No need to stop the compressions and wait. It is mainly because when we stop the compressions, the blood flow to vital organs like the heart and brain will suddenly goes down. But it will take many compressions to regain back to the flow which we occurred by these 30 compressions or so on. Now we are going to the second step, A. A for air. To breathe effectively, the airways of the victim should be open. For that, we have 2 methods to open up the airway. One is head tilt chin lift position and another one is jaw thrust method. The important thing to remember is if we suspect some cervical spine injuries, then we should only do jaw thrust method. For other patients, we can use head tilt chin lift position. Steps to follow to do a head tilt chin lift position. Place your one hand on the forehead of the victim and apply a light pressure with your palm of your hands to tilt the head. Then, with 2 fingers, hold the chin of the victim and lift it up. So, the airway will be open up and victim can breathe without obstructions. If head tilt chin lift position is not working or suspecting for a cervical spine injury, then next step is jaw thrust method. So, to do a jaw thrust method, you have to position yourself to the head end of the victim and place both hands in the side of the victim face and keep the fingers in the jaw angle and use the thumb finger to open up the mouth. The next thing is breathing. B for breathing. So in breathing, there are several methods to provide a rescue breath. While giving the rescue breath, we should aware about some standard precautions that we need to take to prevent ourselves getting some infection that may carried by the victim. Now the different ways to give a rescue breath. First, a mouth-to-mouth breathe, second, a pocket mask method, and third, with an ambu bag, or if we have an advanced airway, we can give breaths like that also. While giving a mouth-to-mouth breathe, you have to pinch nose of the victim and blow into the mouth by enclosing the mouth. If you want, you can keep some towels or cloths in between and see for the visual rising of the chest. When using a mask ventilation, keep the sharper edge over the nose and the rounder edge above the chin. If it is an ambu mask or a pocket mask, use the EC technique to hold the mask and give the rescue breath. If you are giving a rescue breath using an ambu bag, then we should keep the ambu bag and mask in a 90-degree angle and only squeeze the half of the ambu bag because the lung capacity is 500 to 600 and the volume of an ambu bag is around 1 liter. So only need to squeeze the half of the ambu bag. Here's some critical thing to remember while giving a rescue breath. First, we need to see for a visual rise of the chest. Second, we need to give one breath over 1 second and minimize the interruptions by giving 2 breaths in 10 seconds like 1 breath gap then another breath. The maximum time should be less than 10 seconds and we should resume the CPR within 10 seconds. Now we are going to see one additional topic, that is CPR coach. Who is a CPR coach? CPR coach is a person who handles the defibrillator. Now in most of the advanced team there is one person for this CPR coach. He is not the team leader but who can give instructions to minimize the interruptions. Thank you. We can meet in next video. Bye bye.